We will get started here. So welcome everyone again to the webinar today. As I said earlier, my name is Dr. Russell Leonard. I am a doctor of physical therapy. I've been a doctor of physical therapy for about 6 years, 5 or 6 years with Renew the entire time. I am the clinic manager. I run the clinic in the Auburn location currently. And today's presentation is about moving well at any age. So how do we age healthily, right? Healthfully. So the first piece I want to cover over are a couple of objectives for this, this presentation, a couple of things I want to cover over. First, we want to talk a little bit about how to plan for the future, right? How do we know what our future is going to look like, and how do we do that? How do we talk about that? The next is going to be talking about how we interact with the world, right? We have to understand how movement works in order to understand how we can get that working properly for us. We'll do a little bit of discussion about how the muscles and the nervous system interact to make these movements possible. And then at the end, we're going to teach you a little bit about some movement strategies and what things to look for that might indicate there is a problem in a couple of different basic functional motions, such as breathing, the eye and neck control, and then use of the arms and legs. We'll do a brief covering of each of those areas. So diving into it, the first piece, what does my future look like? The first question whenever I talk to people about healthy aging that I ask is, what does your future hold? What does your life look like, your ideal life look like 5, 10, 15 years down the road? If we don't plan for those things, it's going to catch up to us really fast, and we may not be in the situation we want to be. So we got to think, does that involve playing with grandkids, staying active in a sport? Pickleball is a big one. It could be tennis, golf. It could be other activities like knitting or sewing, those types of things. Now, another piece we can think about is, do we have to get on and off the floor in that ideal world? How about getting in and out of a chair, in and out of the car? Are these things that we need to be able to make sure we're doing in our future, right? To be active or independent in your home. Where does that look like? And what does that look like for you? Now, the other piece we want to then talk about, once we have the idea of what does it look like for us, what do we want to have, is where are we now? Can I do those things now, right? All the things we just talked about, am I getting on and off the floor just fine? If I have a problem, that's when we have to ask those other questions, is what am I doing right now to get that back? Because if we don't have it now, if we don't do anything, there's a good chance it's not coming back on its own. So what are we doing actively to restore that ability to do those activities? And if we don't know what that is or how to get there, do we need help to get there, right? There are people who are professionals at helping people get back to those movements. That's what I do on a daily basis. That's what physical therapists do. So if that's something we need help, there are people out there that can do it. Now, if you wait on this and you sit on it, what's going to happen is nothing is likely going to change. And then 10, 15 years will go by and you're still not able to do what you envision is going on for you or what's going to happen for you. So we have to ask those important questions. And once we have that, we can then start to look at where that leads us. So the next piece we want to talk about is how we move. Now, we interact with the world through about 5 different areas of our body. When we talk about moving with our arm follows our hand or our mid-hand. Everything we do is using the end of that hand. We don't tend to push and pull things with our elbow unless our hand is occupied. So we reach for a cup with the end of our hand here. We grab a pencil or a pen. We grab a door handle. We flip a light switch, all with the end of our hand. When it comes to the leg, we follow the midfoot. So the foot is what leads the leg in every motion. When you push off when you're walking, you push off the end of your foot. When you go up and down the stairs, when you go from sitting to standing, heck, even if you're pogo sticking across the front yard, it's always that midfoot. The next piece we talk about is our diaphragm and pelvic floor. So our diaphragm sits just below the rib cage, and the pelvic floor sits at the bottom of that pelvis, and they form the top and bottom of our abdominal cavity, which is where all our internal organs are housed. As we breathe, our diaphragm contracts, pulling oxygen or air into our lungs. When we exhale, that diaphragm comes back up, the pelvic floor moves the opposite way. So those interact with the world to bring air in. Now they also interact with the world a couple other times. When we're using the bathroom, or for intimate relations. That's when the pelvic floor is active. Next, when we look at the actual spine, our motion is led with our eyes and our head. When someone calls your name, we don't turn our head first and then our eyes. We don't turn our shoulders and then our head. We look with our eyes first. We're always tracking with our eyes. So if someone calls your name, you're going to look with your eyes, your head's going to turn, your spine follows the head and the eyes. It doesn't necessarily move on its own. Again, where we interact, where we lead the motion with. And the last thing is our tongue and our jaw. When we consume food, when we eat, we're chewing with our jaw. We use our tongue to move that food around. When we're talking, we use that jaw and that tongue to bend the air and create those noises and sounds along with our vocal cords, but it's that jaw and mouth area. So each of those 5 areas is leading a motion. If you can think of any motion that you do that doesn't include one of those 5 areas, put it in the chat, put it in the Q&A, please. Maybe I'm missing one, but I think I have a pretty good handle on this is kind of how we move. And I hope that is kind of a little bit of a learning piece for you here. So with all of those pieces, we know how everything moves. Let's talk about some basics of movement and control of that movement. So muscles are what creates movement. Muscles lengthen and they shorten. Our muscles are fairly simple in concept structure. When they lengthen, they're generally relaxing. When they shorten, they're generally contracting or becoming more tense or tight. Now, they're not very smart. Our muscles do what they're told by our nervous system. So if we have a muscle problem, it really oftentimes isn't a muscle problem. It's typically a nervous system problem because that's where it's controlled. They just do what they're told to do. Now, there are a couple exceptions to these rules, but for the intents of this presentation, we're not going to dive into those. Now, if we look at the nervous system is the master control. The brain controls everything in our body. Everything that we feel, everything that happens to our body goes there first. We interpret it, and then it sends signals out to the rest of our body. Next, we have our spinal cord, which is the second component of that nervous system, and that assists with more pre-programmed reactions. So that we call them more like our preflexes or reflexes and our pre-programmed reactions. When you're walking or doing a routine thing, your spinal cord takes over that motion to allow that routine motion to continue happening. When you are pushed off balance and you take a quick step, your spinal cord creates that reflex of stiffening up your legs so it doesn't collapse, giving your brain time to then control and to decide how much force goes through that leg, how to tailor that effort. Our brain is very smart. It can adapt and interpret a lot of different things. If there's a way of doing something, it'll find it until it can no longer compensate. So when we're dealing with a pain problem, our brain will find a way of making whatever motion we're trying to accomplish happen, disregarding how normal motion should occur, to get you to that outcome that you're looking for. Sometimes that'll lead to, in the long term, additional injuries or pain problems, or it can cause these compensations of one area doing more work for you than it should with, say, standing. If your back's doing more work and you're dealing with the back pain problem, which is a very common one. So that's a little bit of a piece of that nervous system. So with those two pieces in mind, the muscles and the nervous system, how do we apply that information? Well, we take a look at and we talk about what's called exercise prescription. That's how do we decide what exercise to do, how much of it to do, and all those kind of factors. When we're looking at changing the nervous system, we need to create a longer hold time with our exercises, with our movements. The longer you hold something for, the more time that brain has to figure out what's happening to adapt to that force and to get the correct structures involved, the correct muscles working for you. So when we talk about those exercises in a minute here, a nice long hold at the start is going to allow everything to be in the ideal position to work for you. We're going to work smarter, not necessarily harder. The other piece is we need a higher number of repetitions, more times through the activities. We're trying to learn muscle memory when we're talking about repeating things throughout our day. Those are functional activities, the standing, the sitting, using our arms and legs. The more times we go through the motion, the more our brain is going to learn. We've developed that muscle memory. It becomes more of a routine. We don't have to think about it anymore, and it just happens. And the last thing is the actual effort we give. If we're giving 100% effort, what's happening is our brain is going and trying to make something work beyond a comfortable level. If we keep things working at 50% effort, what's happening is our brain has this excess capacity to learn. It's not threatened at the time. And if our nervous system is threatened, what happens is it tenses up. So if we're learning a new activity or a new motion, we want to keep that effort a little bit less so we can adapt to that force without compensating and going back to the way we were doing if we are in fact moving incorrectly and causing those problems if we've established that they are there. So that's kind of how we develop these exercise activities here. Next, we're going to dive into a couple of them here. And I've got, I think, about 5 different motions that we'll dive into. The first one, we're going to talk about the relaxed seated position. So oftentimes what will happen is when we have lower back pain, our back isn't good at relaxing or letting go. And how we sit is going to be a huge indicator for that. Oftentimes what will happen is we'll think about what our parents have told us growing up is sitting up perfectly ramrod straight. The problem is if we sit up straight, our lower back is actively holding us upright. So in order to sit in a position where our back is able to relax and we're able to relax, what we want to do is we want to stay away from our backrest, because a backrest is a place we can push against. And oftentimes we do, causing those muscles to tighten up some in that back as well. So staying forward away from the backrest. And all you guys watching, hopefully you're testing this out here as we go along. So scooting forward in the front to the front edge of the chair, that front half of the chair. Next, we want to keep our weight even on the hips or the pelvis, those 2 sitting bones where your hips come in. We want to stay balanced on there. You don't want to be too far forward or backward. You don't want to be too far to one side or the other. We want to be right in the middle, feeling like if your muscles were all to give out, you would stay right here over top of those hips. You wouldn't fall in any direction. The next piece you want to talk about here is we want to keep those feet on the floor even. We want even pressure through the feet, even pressure through those hip bones. And once we're there, we're balanced over those hips. I want you to take a nice deep breath in and let out a nice big sigh. Let yourself sink into your hips, allowing your back to slouch very slightly. Now, we're not bending over like we're watching the football game. We're just allowing those shoulders to come down. We're allowing that pressure to sink into the hips, allowing us to relax. And that's going to be our relaxed seated position. So if we're struggling with back pain from things being too tight or taut in the back, being able to sit comfortably is a very important piece. The next thing we're going to be talking about here is our breathing. Okay, so breathing correctly, and we talked about that diaphragm and pelvic floor as our areas. So that diaphragm, let me put a little bit of color into the presentation here. So the diaphragm is right in through here. It's at the bottom edge of that rib cage. It almost looks like a parachute. And that pelvic floor is going to be down in this area here. They create the top and bottom of that abdominal cavity. So we want to make sure as we breathe, we're breathing into that area. So to set ourselves up for success with our breathing, we want to make sure that our lips are together. So we're not breathing through our mouth. Our teeth are slightly apart so that our jaw can stay relaxed. We're not clenching those teeth. And then we press the tongue against the roof of our mouth like you're saying, nah, nah, nah. Having that tongue against the roof of your mouth is going to prevent you from clenching your teeth. If you try and bite your teeth together, you usually can get a good amount of force. But if you press your tongue against the roof of your mouth, go ahead and try that. Push your tongue against the roof of your mouth and then try to bite your teeth together. It's going to be much more difficult. So it's just going to be one of those things we can do to create that relaxation of the jaw. Once we have that set up correct, we're going to breathe through that nose into that abdomen here. Now, where you know if you're going wrong is if you feel your rib cage and your chest expanding a lot. We know we're not getting a good diaphragmatic breath. We're just getting that chest breath. We want to feel that abdomen coming out and coming back in. So if you place one hand on your belly, one hand on your chest, you can usually feel that. You want to feel about 2 times, if not more, moving in that belly than you feel in the chest. And what you should notice as you are breathing this way is you'll feel that abdomen kicking in. You'll feel some abs, you'll feel some pulling or stretching in that abdomen there. All right, let me clear off the drawings here. So that's our breathing piece. The next piece we're going to talk about is the lower extremities, or the legs, how we use them. Now, if we were here, what we talked about earlier was the intent through that midfoot area. And I'm going to give you a little cue on where that midfoot is when we talk about that. So when we talk about the midfoot, we're talking about from just behind this ball of the foot here to just at the front of the heel. So that's all of the midfoot, this whole kind of area in here that I'm shading in here. That's all the midfoot. Now, when we are balancing, when we're using the leg, the whole purpose of that foot is to stay stable in the center of our foot. So we want our pressure in the middle of our foot, because if we're using our toes and the back of our heel to normally stand or to kind of do activities on our feet, they're not available for balance. And that can throw us off, right? If we don't have that reaction or response we can use in the foot, we have to rely on our knees or hips or back to stay balanced versus the foot. And it's a lot easier to stay balanced to the foot because less energy has to be expended to balance there. So in order to work that foot, I want everyone to start in that relaxed seated position we talked about just earlier, where our weight's even through those hips, even through both feet. Once we have that there, we want to take that pressure. Normally, we're going to find it on our heels initially when we're sitting. I want you to take that pressure from the heels and shift it just forward. So it's between the front of the heel and the back of that ball of the foot. So that weight's all through the arch, keeping the pressure off the toes and off the back of the heel. What we should feel here is we should feel almost like that foot is sinking into, if it were sinking into some plush carpet, or if you're almost squashing an orange of fruit underneath that arch of that foot. Now, what you should also feel here is you should notice that there's a little bit of pressure that builds into the arch. And you might even notice something starting to work in that foot, potentially the foot, sometimes up into the calf. And oftentimes we'll also start to feel the rest of the leg engage as we hold this for longer, like we had mentioned, that long hold time. We've set that leg up for success. Now we're just going to hold it in that position until it can engage and work there. Now, for these motions, like we talked about, holding for a good chunk of time. If we hold them for, say, 2, 3, 4 minutes, and we don't feel much of anything, there's a good chance that foot's working how we expect it to. If you notice that it's really hard to stay on the arch of the foot, like it doesn't want to necessarily get in contact with the floor, or that weight keeps going back to the heel, and you have a hard time controlling that midfoot, or you're feeling a lot of fatigue through those muscles of the leg, this is probably an area that we need to work on a little bit for you. It's probably an area that's a problem. And then we'd want to build from here. Now, once we have this pressure to that midfoot area and sitting and we feel comfortable with it, what I want you to do is I want you to stand up. So we're going to stand on our feet in that same position. You may notice that the weight tries to shift either towards the heel or the toes, which is okay, but bring it back to the middle of that foot. And once we're in standing, we want to make sure our knees are slightly bent. So we're going to bend those knees just a little bit, allowing that weight to come down into that foot area, that middle of the foot again, right? This whole center section. Let that weight stay there as we stand, feeling the tension through the foot. You'll probably feel more through the calf or leg in that standing position. That's what we're looking for. I'll give you all just a second to feel what that is as we're practicing. So that's the foot and the leg, how we use those pieces. Now there's a lot of variation we can go to from here. We can go from the double leg position to a single leg position. We can go into a stepping position, but that's kind of beyond the scope of just kind of the beginning pieces here that we're talking about. So moving from the leg, let's go ahead and talk about the upper extremities. And let me get rid of my drawings here. There we go. So in order to work the arms, they all follow the hand. So if we're talking about the mid hand, the principle is very similar to the foot. We want to go from the knuckles of the fingers here to just before the heel of that hand. So the entire palm of that hand. Think the palm of the hand is very much like the arch of the foot. That's the center of that hand where everything happens. That's where we grab hold of things. So in order to put some tension through the hand and get the full arm working how it's supposed to, we want to start off by standing about an arm's length away from the wall. And we're going to take those hands, we're going to place them on the wall about shoulder height, maybe slightly lower than shoulder height. And we want to let that weight come from, initially you'll probably notice the weight goes to the heel of the hand, but I want you to take that weight from the heel of the hand and put it right through this whole mid-hand section here, right in here. From the front of that palm, that kind of end of the palm to the knuckles is where we want to hold that tension. And we want to feel like that hand is sinking into the wall, becoming nice and flat, nice and spread out, good contact with the wall there. Now we want to keep that pressure off the heel of the hand, especially because if we do that, if we put that pressure through the heel of the hand, we're not using the wrist muscles and the hand muscles. We're just using the muscles of the upper arm because they don't have to engage if we're not pushing through the hand, which is what I'll see problems with a lot of people here. When they struggle with using their arm, oftentimes they'll find that their weight always comes back to the heel of their hand. They're pushing with that end right down here versus that middle section of the hand, which can create compensations up the arm. Oftentimes what else I'll see is if they have a weak grip strength, they find that holding on to objects is difficult. It can be because we're not necessarily using that hand as well as we otherwise should. Now, this can be done a very similar way. We can go from both hands on the wall. We can go to a single hand on the wall. We can do a press-up motion in that same position. This position doesn't change, just like the mid-foot position didn't change. We want to use those areas because that's how we interact with the world, right? If our hand and foot are working effectively, there's a good chance we can use the rest of the arm. But if we can't push through the hand in a certain direction, we're not going to be using the arm in that direction either. And those muscles, our brain will find a way to work around them. And then eventually we're not going to be able to compensate for it anymore. And that's going to create a pain problem for us most often, or a more serious injury that stems from that pain problem. So that is the arms that we're talking about there. Now, let's move on to the spine a little bit. Now, like we mentioned earlier, when our spine is moving, it follows our eyes and our neck. So we want to make sure that we have really good control of those eyes and that neck here. So the first thing we want to do is we want to make sure that our neck is relaxed. So we want to find a position where we're reclined, either sitting or laying down with your head supported so that we can relax that neck. So we're not having to hold tension through those muscles in the base of the skull and that neck area. Next, what we want to do is we want to move just our eyes. So you want your head in place. You want to stay in one position. With your eyes, we want to take those and we want to start off by looking straight down, keeping that head still. We should be able to look to the edge of our range of motion. We should be able to look straight down without much issue, without much strain. Now, where I see problems with the eye control and a lot of people is if they've worked a job where they have to stare at a fixed location for a length of time, such as working at a desk or at a computer. Anyone who's looking at one location doesn't get a lot of that eye motion through the full range of what they can do. The other area I see a problem oftentimes is people who wear correction, who wear glasses. Because with your glasses, your world is what's inside your lens, especially smaller glasses. Now, if I look up, I'm looking outside my glasses, and what happens is we kind of lose the world if our vision correction is strong enough, because we can't actually see out there. So why would we look in an area we can't see? It makes sense from a visual perspective, but when we're looking at the full body movement, that's a range of motion we're just not using out of those eyes. And we have muscles that control that motion. So what will oftentimes start to happen is people will start to get a little bit of that disorientation sensation. Sometimes this can trigger vertigo because we're not getting those inputs from the visual system, and it's creating some chaos in our brain. There's some misinformation between what the eyes are telling us and what our body the rest of our body is telling us where gravity is and where our body is positioned. So we have to make sure we're able to use that full range of our eyes. So we want to also repeat that motion looking to the left side. So your eyes are going to look left to that edge of your balance or edge of your vision and holding it there. Now, just like the other motions, we should be able to hold this for a minute, 2 minutes, 3 minutes without any disorientation, without any lightheadedness. If we're getting those things, that's a sign there's probably a problem there. And the other piece, we want to make sure that that head doesn't have to follow along. Oftentimes people will feel their head wanting to go with their eyes. We should be able to move our eyes separately from that head. Otherwise, we're getting a really tight interaction between our vision and our neck muscles, which can create that tension at this top of the neck. And if we have tension through the base of that skull and that neck area, there's a good chance we're not moving very well through our mid-back and our low back as well. Now we'd also repeat looking to the right. We can also repeat looking up toward our forehead or toward the ceiling, just those eyes, not the head yet. Now, if our eye motions work all just fine, there's no problems with that. Next, what we can do is we can add in the head to that motion. So what we do is we would look down with the eyes, and then we let our chin tuck down towards our chest, letting that neck follow the eyes. With that motion, you should start to feel something pulling and stretching oftentimes. We shouldn't get too much stretch, but a little bit of a pull. Oftentimes, if things are restricted or tight, you'll get a lot of big stretch across the whole length of that neck. Sometimes it's more towards the base of the skull. Sometimes it's more towards the shoulder blade or shoulder area there, but some kind of a pull. If you can hold the eyes there and you go into the end of that range where it's comfortable, don't force it. Again, 50% effort. You should notice over time with our breathing and with that kind of relaxing in that position that it starts to let go and relax a little bit. That's a good way of starting to move that neck and spine, getting some stretch and motion out of that neck. You can repeat with a couple other motions. You can go looking up towards your forehead, keeping the eyes up towards your forehead and letting that face come up towards the ceiling, like you're tipping that head backward. That can create a stretch down the front of the throat, but you have to make sure your tongue stays on the roof of your mouth with that motion. That's going to get the front of the neck moving versus the back of the neck when you're coming down. The next piece that we can do is a little bit of a funky one. What you'll do is you'll take those eyes and you'll look off to the side. So if you're looking to the right, and then you're going to let the head follow those eyes, tipping to the right side, right? That kind of side bending motion here, letting that go to the side, just like these pictures on the right-hand side here, tipping the head to the side. Now, once we've had those tipping to the side there, again, we're probably going to feel some stretch down the sides of the neck here and here. One last motion you can do out of the neck is the actual twisting motion. So again, if you're looking towards that right side, you would turn that head all the way to that right side. And you can repeat to the other side as well. Now, with any of these motions, if they don't feel symmetrical right and left, if you're getting a lot of restriction or pull or stretch, or they're very tight, there's a good chance there may be something going on there that might cause a problem either now or down the road, right down the line. So you got to make sure you're careful with these motions. And these are just screening motions, making sure we're getting the basics right. If they all feel good and they're all doing a good job, we're not getting too much restriction or pull, there's a good chance the eyes and neck are moving okay. But again, this is just supposed to be a way of helping you kind of figure out if there may be a problem there. Now, those are the motions I had to cover with you today. If you've gone through these and you say, hey, there may be a problem here, but I'm not really sure if there is. At Renew Physical Therapy, all of our locations, which there are 15 locations, offer a free 15-minute screening. What that screening is it's a discussion with a doctor of physical therapy like myself, and we will discuss with you what's going on, what brought you into the clinic that day, and we'll talk about these things. We'll talk how is your day-to-day function going? Are there things that you're not necessarily doing that you want to be able to do? What problems are we having pain-wise or movement-wise? And we can help you with a no-pressure discussion to determine what the next what's the best next step for you, whether that is physical therapy or whether that's a consult with a surgeon, if it's something more potentially dangerous, or if you need to go back to see your primary care, we can help you with that decision. Ultimately, that's what that 15-minute screening is for, helping you figure out what you do, because sometimes when we're dealing with these types of issues, it can be easy to feel lost, and we want to help you find a solution for that. Okay, if it is us, great, we will do our best to help you. But if it's not us, we want to send you to that right person so you can get the help you need, because sometimes navigating that healthcare system can be quite challenging. Okay, and we want to make sure that that is a little bit easier for you guys. Other than that, that's the presentation for today. So if you guys do have questions, please put them in the question and answer the Q&A section. There is that button at the edge of the conversation there on the screen. Type your questions and I will gladly answer any that you have. I definitely have some time here to cover through some of those if you do have them.
Thanks, Russell. We do have a couple questions that came in from the registrations.
Sure
but
thing.
there is still time to ask questions live. So as he mentioned, if you have a question and you're here with us live, just click the Q&A button and that'll pop up for us to answer. The first question we had, somebody said a drop in the barometric pressure has a pretty great effect on their joint stiffness and aches. They're wondering why is that and how can they compensate?
Okay, noticing some changes in barometric pressure and weather causing some joint stiffness or problems in that regard. Okay, that's a very common thing that we hear. It's one of those things that started out as an old wives' tale that everyone seems to know. The problem with that is they've done some research and there doesn't seem to be a link between barometric pressure and any joint issues. They can't tie anything together with research. Now, when we are talking about that joint stiffness and pain, though, one of the things we can look at is how pain works. Now, pain is a very complex, ever-changing thing. It's a construct that has all these different influencers, from how well we've slept, to what activities we've done, to nutrition, what we've eaten, to our mental state, to what we think about different activities, whether we're stressed or not. All these things can influence pain. And all these things are constantly changing. So it's pretty easy to tie changes to pain to changes to the weather, because the weather is constantly changing as well, especially where I'm from in Michigan here. Weather is changing constantly. So it's easy to point the blame at something that's always changing for something else that's always changing and making that correlation. The problem with that correlation is there isn't any evidence to back that up in the research. And there are so many other factors. So it's a good way of looking into and asking yourself, what other factors do I have going on, right? Am I stressed? Does potentially a change in weather, if it's gloomy and cold out, does that make me feel kind of tired, or do I feel more tense in that moment? And that's what's causing some of those aches and pains. So it's more this awareness of all these other things that can affect our pain, more than just weather, because there's a lot of things we can control if we track them and we keep our eye on them and what's going on. But yeah, that was a great question, Kate.
Sounds great. Another one, they said, I know several seniors who have trouble walking. Some have even just lost the use of their legs. How does this generally happen?
That's a great question. I'm going to back up slides to the lower extremity slide. Now, when it comes to using our legs, right, if we're not using the entirety of that middle of the foot, right? So if we're not using that area of the foot from the ball of the foot to the heel for stability, if we're not using this area and we start to rely on our toes or our heel for normal things like standing or walking, we don't have these toes to respond to any loss of balance. We also don't have this heel to respond to any loss of balance. If we're grounded in the center, we have the capability for those. Now, if we're moving around and we're constantly using our toes to grab the ground, we're constantly driving through our heel, any loss of balance is going to require a step or movement from the hips and knees. Now, as we age, if we're less active, that can be a scary thing because we don't want to fall. A lot of people, as we get older, we start kind of being afraid of different activities, so we don't do them as much. Now, if we're not doing those activities, we're not challenging our balance, and we're more afraid of falling, that's going to cause us to stiffen up. And as we stiffen up, we're not going to balance as well. We're probably not going to stay through that midfoot. We're going to use the whole foot. We're going to grab with the toes, giving us less ability to respond to any balance challenge. And it's this negative loop. That's a spiral, right? We're going to constantly stay in that state unless we can convince our body to start using the midfoot again and restoring that ability to balance through that foot. Because once we have that control to the foot, that makes a huge difference. If you're grounded and stable on your feet, balance becomes much easier. That can improve your confidence with activities. And when our brain is confident with a movement, it doesn't fight us. It just allows us to move more freely. Does that kind of answer that question, Kate, you think?
Absolutely. That sounds great.
Awesome.
I did just get a live question. There's still time. If you want to sneak in another live question, go ahead and submit it through the Q&A. This person is asking, how important is good hydration when it comes to movement as we age?
Hydration is a very critical component. When I don't have the research sitting in front of me, so I don't quote me on the exact numbers. But if we are slightly dehydrated, the muscle function decreases quite significantly, right? If we're only slightly dehydrated, that's just slightly deficient in water. Our motor function is something like 80% of what it otherwise could be at optimal hydration. So having that water helps to just kind of move everything along in our body. If we think about our body, it's 70% water, right? Inside of every cell. Our blood, what carries all of these nutrients to our body is this liquid. It's water ultimately, mixed with all these other different nutrients and chemicals and things that our body naturally produces. So having that to transport to our body, being able to filter out and get rid of waste products in our body that can be damaging to our motor function, all of that is critical for motor function. So yeah, making sure you're hydrated, drinking enough water throughout the day is a definitely critical component, just like nutrition as well, most definitely. Does that answer our person's question?
Yeah, I think so. If whoever asked that, if you have any follow-up questions, feel free to submit those. I'm getting a couple more live questions too, which is great. Somebody asked, what role does arch support play in the balance of the foot?
Excellent question. Excellent question. So if we're looking, same slide here again, if we're looking at that midfoot, right? What you'll notice is the midfoot is essentially the arch. Now, we want to get as much of that midfoot in contact with the floor because that provides more stability. If we put an arch support in here, what we're doing is we're making it easier for that midfoot to become in contact with the floor, or in this case, our shoe, because it's typically inside that shoe. So we're getting more contact through that foot. So what an arch support does is it's very similar to any other type of brace. It makes it easier to use that area of the foot in the short term, but they can get in the way of really learning how to use that area outside of having an arch support. So if the muscles of the foot are working well, they shouldn't need an arch support. But if they're having a little bit of a hard time, using an arch support for a short time while you're working on training that midfoot area to work better can be useful to kind of get the feel of what those muscles feel like when they're working, to get those engaging in the first place. So arch supports, just like any other bracing, can be useful under certain circumstances, but we probably don't want to rely on them unless there's a significant reason for that, right? For just a normal situation, we don't want to become reliant on them for our entire lifetime, right? That's kind of that piece. Yeah.
Great, thank you. Another person asked what you think about chiropractic care. So maybe you could just explain some of the differences between physical therapy and chiropractic.
Yeah, sure thing. With all professions, what you find is there are some people in a profession that are more dedicated to their profession and their trade and their craft than there are others, right? Some people are better at what they do than others. That's just a fact of the world of just that natural piece there. So I'm not claiming I'm the best physical therapist. I definitely try to continue my education. There are some that are better than me. There are some that are probably worse than me. I'm somewhere probably in the middle, if that. Same thing goes for chiropractors. Now, when it comes to those two professions, you have to make sure that you're getting a quality practitioner, someone who knows what they're doing and can help you. What I always tell you is my patients is the best key for knowing if you have someone who knows what they're doing is, can they explain things to you in a way that makes sense to you? Because if you're explaining something, if you have a chiropractor who's explaining something to you or trying to tell you what's going on and it's way over your head, they may know what they're doing, but you don't know what's happening. So you're going to be more tense. You're probably going to not get as much out of the treatment as if you were calm during that session and they were able to kind of ease those worries of what's happening, right? I always like to focus on kind of the why we're doing what we're doing so that we can understand exactly what's happening in the body, right? Where we're trying to put our pressure, those kind of things. Sometimes with chiropractors, what you'll find is they'll want to do something to you, and then they will want you to come back over and over again for that same issue. And they'll never have you do something as well. That's typically where I have a problem with chiropractors. From my perspective with healthcare, our goal should be to help you not need us again, right? So you come in with a problem, my goal is to help you get rid of that problem for good. And I'm going to have you do activities and teach you how to do all the things we're doing in the session to get rid of that problem so you don't have to come back. Which I have met some wonderful chiropractors that that's what they do as well. I've also met some chiropractors that they view their people as essentially an asset. So they keep coming back and keep putting money in their pockets, which to my perspective is the wrong way to approach that situation. So it depends on what kind of chiropractor you have. I know I'm getting a little long-winded on this, but it's a really common question and it's really sometimes misunderstood about healthcare. It depends on the perspective of the individual ultimately. But hopefully that's a couple of pointers and cues that help you get there.
Yeah, I think that's great advice. I've heard it described as finding somebody with the heart of a teacher. And I've definitely heard that from your patients. I know you're not one to toot your own horn, but I've seen that in your testimonials. So we appreciate that. I think that's all we have for questions. Oh, I did get another one just come up. Is chiropractic necessary as a monthly maintenance? And I think that's kind of what you were saying. That would hopefully not be the goal.
If we're going to chiropractic care every month and they want us to come for the rest of our lives for maintenance, we have to be really aware of what it is that they're talking about maintaining at this point. If we're talking about just a routine injury of some sort or a pain problem, that may not be necessarily needed if we can resolve it for good in another way. It's a tricky question to ask because I don't know what the problem or the issue is. For some issues, maintenance treatment is needed if there is a serious structural problem or injury to a body structure. If there is no injury to a structural issue, if there's no structural issues in that body, oftentimes management isn't what's needed. For some patients, when I do maintenance therapy, typically that's patients who can't do things for themselves on their own. So I have some patients who are quadriplegic who are in a wheelchair and they don't have adequate support at home. That's the kind of patient I will do maintenance therapy with because they can't do the activities or the things at home to manage their situation. What I'd always ask, and what I'd encourage you to ask your chiropractor is, what can I do to manage this at home? And if they don't have a way of teaching you something to do at home, that's kind of the answer I was getting to earlier, is maybe they don't know how to help you further than they have at this point. Maybe they only know how to maintain where you're at, not get you the relief that you probably really want and getting back to what you actually care to do. Does that answer your question? Hopefully that kind of gives you a couple of things to think about.
Yeah, I think that's excellent food for thought. Very well done. Well, thank you, Dr. Russell. I do want to mention to everybody who registered as well, you will receive an email follow-up that has a couple top takeaways from today, and it will also have the webinar recording. So if there was a part that you kind of wanted to rewatch or an exercise you wanted to try again, you'll have the option to do that with the recording. But other than that, we just say thank you to Dr. Leonard, and thank you to everybody who joined us today.